This is the liberation procedure, one Canadian doctors will not do. But it gave Saskatchewan MS patients like Jacquie Sivertson enough hope to spend thousands of dollars traveling overseas to have her neck veins opened.
Then I had way more strength and energy. I just couldn't believe how I could just go walking and walking in it. The one day, even in Sofia, we walked around for about 3 hours.
Sivertson said that lasted about 4 years, relief from her MS symptoms. Then she was diagnosed with cancer, which she fought off 1.5 years ago. But at Christmas, her legs gave out. Today, she can't walk. She's at the Wascana Rehab Center, just learning how to stand. Still, she and other MS patients tell me that they never saw the liberation therapy as a cure. They saw it as buying quality of life.
And that's a risk factor for MS.
This neuroscientist says today's findings from British Columbia show liberation therapy is not worth the risk.
So this was a really thorough, well thought out study. And at the end of 48 weeks, at the end of almost a year, everybody was the same. And that shows it doesn't work.
Dr. Michael Levin says over the past 20 years, MS research has grown far more sophisticated. He says bone marrow transplants show promise, as does new medication, which appears to stop even advanced forms of the autoimmune disease.
The brain is a protected environment. It's protected in something behind the blood-brain barrier. And so that keeps the antibodies in your brain and my brain, it keeps the antibodies from getting into the brain. In MS patients, there's damage to this barrier, and the antibodies can sneak in and begin to stick to neurons and cause damage to them.
Dr. Levin is about to spend the next 7 years doing MS research right here in Saskatoon. Now, he says these negative results about the liberation therapy aren't such a bad thing. He says you need negative results in science so that you can steer your research in other directions. Ultimately, he says that's what will lead to better treatments and better therapies for MS patients, not just here in Saskatchewan, but around the world. Jennifer Quesnel, CBC News, Saskatoon.